Assessment of the eyes and ears includes taking a thorough health history and performing a physical examination.
The primary goal of nurse-patient interview is to improve the well-being of the patient. In the interview, try to establish a trusting, supportive relationship, gather information, offer information. Taking a patient health history is a conversation with purpose and the ability to communicate and relay therapeutically with the patient is one of the most valued skills of clinical care. During the interview, you will draw on many interpersonal skills you use every day, but with unique and important differences.
Patient stands 20 feet from the chart. Next is you need to teach eyes separately, having patient cover the opposite eye being tested, then together with and without corrective lenses. Next is known smallest line of print. Patient is able to read with no more than 2 mistakes. Lastly, let the patient read letters without correction and Snellen chart corresponding with 20/20 in the left and 20/20 in the right eye and both eyes. Have patient hold the news screen about 14 inches away and read. And the next, let the patient read the news screen easily at a distance of 14 inches.
First, stand in front of patient face to face about 1.5 feet apart. Second, ask patient to fix gaze, straight ahead and cover one eye. Third, bring a pen or wiggle your finger in from the periphery from 4 different fields: the superior, inferior, temporal, and the nasal. Fourth, have patient say now. One's fingers or objects are seen. Fifth, measure degree of peripheral vision using patient's fixed gaze as a base.
First, stand in front of the patient and instruct him or her to fix gaze straight ahead. Second, instruct the patient to follow your finger or an object such as a pen through 6 cardinal fields. Third, note patient's ability to do so and note any signs of nystagmus. Shine light directly in patient's eyes. Note the position of the light reflection of the cornea in each eye. Light should be seen symmetrically on each cornea. Cover patient's one eye and have patient focus on object afar. Second, uncover the eye and note any drifting. Gaze should be steady when eye is covered and uncovered. No drifting.
Observe the eye for pertussis, exophthalmos, lesions, deformities, or symmetry. Spread the eyelids with your fingers and inspect the conjunctiva and sclera. Ask the patient to look up, down, left and right to inspect the bulbar surface. Stand about 1 feet from patient at a 15-degree angle from patient's line of vision. Place index finger on lens wheel and turn wheel as needed to focus. Keep free hand on patient's forehead to determine distance or closest patient. Begin with lens wheel at 0, shining light on patient's pupil to identify red light reflex. To test for optic disc, first move closer within inches from patient, turning the lens wheel to focus as needed. Identify the structures. Disc located nasally, follow blood vessels to disc and note color, borders, and shape. And also, test for the blood vessels and macula. Inspect for the angle of attachment. Note the color. The size must be greater than 4 cm and smaller than 10 cm. It should have normal shape and presence of landmarks. Inspect for the position, condition of the skin, and drainage. Palpate for the consistency and tenderness. Always palpate the tragus, mastoid process, and helix.
Use shortest and largest speculum that will accommodate ear canal. Have patient tilt head opposite direction. Hold otoscope like a pen with the handle up, raising hand on patient's head. Or hold otoscope like a pen with the handle down and through magnifying lens. Look before inserting speculum into the external ear canal. Insert only in the outer third of the canal. Note for color, drainage, and lesions.
Note the color, position of landmarks, intactness of drum. Never irrigate the canal unless you are sure the drum is intact. Have the patient cover opposite ear being tested. Stand about 1 to 2 feet behind patient and whisper. Note the patient's ability to hear sound. Have the patient cover opposite ear being tested. Hold ticking watch within 5 inches from ear. Note the patient's ability to hear sound. Hold the tuning fork by the stem. Tap the tuning fork prongs on palm of your hand. Place the vibrating tuning fork in the middle of the patient's forehead. Note lateralization of sound. Place vibrating tuning fork on the mastoid process. Count the time until patient can no longer hear the sound. Immediately bring the tuning fork in front of the ear. Continue to note the length of time until patient can no longer hear the sound.